tonight's topic is the clinical applications of glutathione, and I must put in bracket and its precursors, because we are actually dealing more with its precursors than glutathione itself in the application. Okay, first a disclaimer. We don't make any therapeutic claims. We're only sharing what knowledge is available and some of our own experience. Our recommendations are based on known science of glutathione, and there are many studies done on glutathione and on ribosine, which is the patented glutathione precursor belonging to this company. And ribosine is not officially promoted for treatment or prevention of any disease, and it's officially only recommended for improving and maintaining good health in adults. Right? Have to make that declaration first. The content of the talk this evening will be: what is glutathione? What are the functions of glutathione? What are the current uses of glutathione and its precursors? What are the possible clinical applications of glutathione and precursors? One or two case reports. Then ribosine, introducing ribosine, a novel glutathione precursor, and some conclusions and some suggestions. We got to get this away. Okay. A little bit about evidence-based medicine, just to clear some misconception about the terms used. You will hear these terms even used. There is sufficient evidence, right? So when they say that there is sufficient evidence, it means that there are enough studies, and especially if the studies have already been grouped together and reviewed through a systematic review, or what more if there's also a meta-analysis, and then the conclusion can be made whether the method or the drug or whatever is being studied is effective or not effective or still equivocal. Even large studies can come out the conclusion, it's half-half. But at least the studies are sufficient. And then you have the statement that there is insufficient evidence. And usually this is due to the number of studies being too small, or even if there's many studies, but the number of subjects are too small, so it's still not enough to be statistically significant overall, or the studies done are not up to the required standard. For example, not randomized, not double-blind, etc. So which means no concrete conclusion can be made. And then you have statements that say there is no evidence. No evidence can mean no studies done, or sufficient studies done, as in the first category, but these studies show that the method or the drug is not effective, right? So no evidence can be actually restated in those cases that have enough studies, restated as there is sufficient evidence to conclude that the method does not work. Okay, which can be also stated as there is no evidence to say that the method works. But it can be confusing because if no studies are done, also there's no evidence. So you need to know what is actually meant. Why I bring this out is because there is a common mistake that when the term insufficient evidence is used, people tend to then conclude that then the method is not effective. All right? It's often wrongly interpreted as it's not effective, even though all or majority of the small studies done may show that it is effective. But because it doesn't qualify in terms of number, in terms of the standard of studies, so a definitive conclusion cannot be made. But the right interpretation would be that although the results are positive, more larger and better studies are needed to confirm the finding. So it is, for many things, the results are actually positive, but the evidence is still insufficient. But when you say there's insufficient evidence, the tendency is to view it negatively, right? This is important because it applies to glutathione, as you will see. Okay, so let's move on to what is glutathione. This is a naturally produced molecule, one of the most important endogenous molecules produced by our body, for many decades known as a master antioxidant and the most powerful detoxifier, has been touted by experts and doctors and scientists with many accolades: the master antioxidant, the superhero of antioxidants, etc. And this is the molecule made of 3 amino acids. On the left is glutamic acid, and center is cysteine, and on the right is glycine, and it is the cysteine at the center that carries the thiol or sulfhydryl group, SH, that gives glutathione its versatility. The chemical short form for the active or reduced form of glutathione is GSH, but the G refers to the bulk of the molecule, right? That's G, and the SH refers to that thiol group, the one sulfur atom and one hydrogen atom. Okay, so of all the many functions, we must know at least 5. Now, these are the 5 we must know. For a long time, it's been known as the most important intracellular antioxidant. All right, it's the most important for the cells, therefore must be for the organs and the body, because all the organs are made of cells. It's a very powerful anti-inflammatory agent, very powerful immune booster and modulator, very powerful detoxifier, and a versatile signaling molecule. These 5 we must know. Well, you want to know the whole range of functions? Okay, let's go through. All right, first 5 already mentioned: master antioxidant, therefore fighting free radicals and reversing oxidative stress and maintaining redox homeostasis or redox balance in the cells, right? Anti-inflammation mentioned, immune function modulation mentioned, detoxification and cell signaling mentioned. Other functions is involved in gene expression, in DNA synthesis and repair, in cell differentiation, proliferation and apoptosis. And then protein synthesis, folding and function, involved in cysteine transport and reservoir, because it has cysteine, so it serves as a moves cysteine from around. At the same time, also as a reserve for cysteine. It's involved in prostaglandin synthesis, involved in antiviral defense, involved in coagulation control, involved in the aging process and diseases of aging. Okay, it regulates nitric oxide, it regenerates vitamin C and vitamin E, removes mercury out of cells and the brain, helps maintain the integrity of the blood-brain barrier, is a coenzyme or cofactor for several enzymes. At least this activates these enzymes. This involves in iron metabolism, including sensing and regulation of iron levels, iron trafficking, and synthesis of iron cofactors. It is glutathione that regulates the transport and release of oxygen by hemoglobin. Okay, so many functions, even the basic function of carrying oxygen to the rest of the body. And even though mentioned earlier on about its boosting immune function, it supports the functions of both the innate and adaptive immune systems, including T lymphocyte proliferation, phagocytic activity of polymorphonuclear neutrophils, dendritic cell function, and antigen presentation by antigen-presenting cells. Why I have to mention this? Because COVID is up again, and we have to revise our knowledge about the importance of glutathione for our immune system to fight viruses, including COVID-19. Okay. So what happens if you have low glutathione? So many diseases have been studied and shown to be associated with having low glutathione levels, including heart attack, stroke, cancer, diabetes. All right. So all the top killer diseases are associated with having low glutathione, low levels of glutathione. In fact, almost all diseases, if you just Google and study with any disease, you click on glutathione is involved. Okay. And this is the latest review of November last year. And the review title is a Samsonian life-sustaining small molecule that protects against oxidative stress, aging, and damaging inflammation. That's referring to glutathione. What is Samsonian? Well, you know, Samson and Goliath. All right. It's a small molecule, but has such power and versatility that the author gives it this title, right? It's a Samsonian molecule. So what does this study conclude? Right? It looks at chronic diseases especially, that all chronic diseases, including COVID-19, with the long COVID-19 syndrome, are characterized by the presence of persistent chronic inflammation and sustained oxidative stress. Right? So these are the groups of chronic inflammatory diseases that were reviewed, including lower respiratory system, right? The whole list of diseases there. Then cardio and cerebrovascular systems, right? Atherosclerosis, ischemic heart disease, stroke, and others, and many other systemic inflammatory diseases like diabetes and the long COVID-19 syndrome. Okay, we're seeing a lot of people dropping dead, right? Young people dropping dead. Okay. Okay, and all are characterized by persistent inflammation, continuous production of reactive oxygen or nitrogen species, and oxidative stress that predominate over the antioxidant defenses, which may include glutathione and other free radical scavengers and enzymes, resulting in cell, tissue, organ aging associated with early premature chronic inflammation. Right? So they reviewed a whole list of chronic diseases across the systems and found that inflammation and oxidative stress are the common factors, and that the antioxidant and anti-inflammatory defenses have been overwhelmed. That's why you end up with those diseases. And they concluded that glutathione is a potential intervention, that is, the therapeutic intervention or treatment, to counteract many chronic diseases, including long COVID syndrome, since glutathione levels are correlated with tissue and organ damage, disease severity and progression, and disease outcomes. So when they reviewed the whole range of diseases, they found that there's a correlation between glutathione levels and the degree of damage and the prognosis. Right? The lower the glutathione, the worse is the picture. The higher the glutathione, the better the picture. Therefore, enhancing glutathione is a potential treatment option for inflammatory diseases by reducing oxidative stress and cytokine expression, especially in diabetic patients. And glutathione boosting supplementation improves oxidative stress, mitochondrial dysfunction, inflammation, insulin resistance, endothelial dysfunction, genotoxicity, muscle strength. Genotoxicity means toxicity to the genes, yeah? Cognition and surfactant regeneration, favorably affecting disease outcomes and the aging process. Right? So then the whole review done shows glutathione levels correlate with the degree of damage and therefore the progress of the disease and the prognosis. And then boosting glutathione improves so many factors and improve the disease outcomes and also improve the aging process. Okay. And then we look at overall the effect of glutathione on aging and longevity. Studies clearly show correlation between high levels of glutathione activity and longevity. Way back in 1998, a study showed that higher levels of active glutathione in centenarians when compared to those who are 30 to 40 years younger, right? So those who live long had high levels of glutathione. Another study 4 years later showed that women aged 60 to 103 who were followed for 5 years, and they found out that those with the highest levels of glutathione were the ones who remained healthy and lived longest, right? They were the least, less likely to die. Okay, so again, glutathione equals longevity. Right, these are some references. There are many, many references. Okay, with all the whole list of important functions and evidence that high glutathione means less disease if you have disease, and longevity and slow aging, it is terribly disappointing to know that these are the only accepted clinical uses of glutathione or boosting glutathione with its precursors. One is in the treatment of paracetamol poisoning. And two is in the treatment of respiratory diseases with thick mucus secretions, example, upper respiratory tract infection, thick mucus, pneumonia, and cystic fibrosis. Okay, some oncologists use glutathione to try to treat severe toxicity from the chemo cytotoxic drugs that they use, but this is not recommended by other oncologists because the treatment will then reduce the efficacy of the drug, because the whole idea of cytotoxic drugs is to poison the cancer. Of course, the side effect is the collateral damage of the poisoning the healthy cells too. But when you give or boost glutathione, then the glutathione will protect both the healthy cells and the cancer cells. Okay, so while paracetamol poisoning is an established indication for the use of glutathione or its precursors, there are other liver conditions. Paracetamol poisoning damages the liver. There are other liver conditions that some doctors and health practitioners will use or boost glutathione, but this is not established clinical practice. Okay, so it's really surprising. With such a versatile and powerful molecule like glutathione, it has so much potential. These are the only uses now. Okay, so this is my conclusion over what's happening. Despite its importance in so many organ systems and its versatility in impacting health via many pathways, glutathione is only used in a few disease conditions. And despite the abundance of research covering many disease conditions, the studies on specific diseases are not large enough in size and numbers to make therapeutic claims possible. Okay, that's why I started out with the terminology used, insufficient evidence. But to have sufficient evidence, you need larger studies. And to have larger studies, you need budget. But the drug companies are not interested. The reason is that this is not a drug that can be patented, so money is not spent to prove its efficacy in preventing and treating diseases because the drug companies cannot profit from it. All right, there are research universities doing research, but they don't have the kind of budget necessary to have large enough studies to make definitive claims. But because we know the science behind glutathione, those of us, doctors and non-doctors, who are looking for safe therapies should get to know glutathione and what it can do to our health. So let's explore what are the potential uses, what are the potential clinical uses. First is its potential use in boosting immunity against viral infections, because there's another COVID wave right now happening. Okay, I don't know in Malaysia is what wave number 5 or 6. In some countries it's probably wave number 10. But the numbers are increasing very fast. Okay, so let's revise, right? So starting from China and until now, after what, 1, 2, 3, 4th year now, right? It started in end of 2019. Now it's end of 2013. Sorry, 2023 is 4 years. And then never-ending waves of COVID-19, right? With new variants and sub-variants, all right? And then vaccinations have failed to prevent infection, right? In spite of the claims at the beginning that gave us hope. Okay, and prophylactic drugs like ivermectin, until now there's still controversy. I know I'm very much into this part of this controversy. But fortunately, in January of this year, there was one definitive study that showed that ivermectin does help prevent infection. Okay, but today is about glutathione. Okay, so how important is glutathione in making sure that our immune cells work properly? First, you need to know that our immune cells work as a team against viruses. So there are various types of immune cells, each with this particular function, and they work step by step. And in the end, you end up with the killer cells, which will kill the infected cells, and then you end up, and then you have the B cells that produce the antibodies, will then neutralize the viral antigens. So you see, in this scheme, there are many parts that require glutathione for the cells to function. Okay, glutathione is needed here, right, in the antigen-presenting cells. Glutathione is required here by the T helper cell. Glutathione is required here by the killer cells. Glutathione is required here by the B cells. So every cell in the immune system requires glutathione to function. Glutathione fine-tunes the immune system, enables precision defense to be exacted against the invaders. So the immune response to the viruses is independent of the glutathione's antioxidant properties. The fine-tuning applies also to response to other infections other than viruses. Yeah? And this may help prevent infection and or reduce severity of infection. And the importance of glutathione is such that when it, many years back, it was already discovered that the level of intracellular glutathione can predict the prognosis of HIV infections. And this is probably true for other viral infections as well. So how does glutathione help in COVID-19? We know that glutathione reduces oxidative stress, reduces inflammation, enhances immunity against viruses, stops viral replication, prevents cytokine storm, helps liquefy respiratory secretions, helps prevent abnormal blood coagulation, and protects the lungs and all major organs. And all this is applicable in COVID-19. So glutathione can help reduce the severity of COVID-19 in many, many ways, and may help prevent long COVID, which affects many organs for many months. Okay, remember December 2019, COVID in Wuhan. By 18th March 2020 was our first lockdown, so we were already having a wave. In April, just 1 month later, this small study was released in a journal the study was done in US. Maybe just a case report of only two patients. But the remarkable thing is, they used oral and IV glutathione and glutathione precursors to treat COVID-19, these 2 cases with COVID-19 pneumonia, and they discovered that they improved within 1 hour. Right? You would expect that with this kind of fantastic results, then there will be many more follow-up studies. But nobody was interested. This was not a drug. Nobody can make money. So it's a pity, right? Very early in the pandemic, glutathione was already shown to be effective in treating COVID-19's moderate and severe cases. So my opinion is that from knowing the many ways glutathione is involved in antiviral immunity, researchers should be focusing on glutathione instead of the drugs, which, even if they work, have severe side effects. With glutathione, we get many other benefits, right? With all the list of its function, if you boost glutathione because of one reason, you still get all the other benefits, right? And then in the month after that, a review came out which concluded that endogenous deficiency of glutathione as the most likely cause of serious manifestations and death in COVID-19 patients, right? The study almost said that if you have high levels of glutathione, you will never die of COVID-19, right? Remember, conclusion, glutathione deficiency is the most plausible explanation for serious manifestation and death in COVID-19 patients. And then another review. Could glutathione depletion be the Trojan horse of COVID-19 mortality? Conclusion. This preclinical study shows that glutathione depletion may have a central role in COVID-19 mortality and pathophysiology. Therefore, elevating the glutathione level in tissues may decrease the severity and mortality rates of COVID-19. Another review. The role of glutathione in protecting against a severe inflammatory response triggered by COVID-19. Conclusion, right? Reduced levels of glutathione in the main conditions clinically associated with severe disease was what they discovered. So, 3 reviews all concluded that the lack of glutathione, the low level of glutathione is what is a major factor why people get severe COVID. And if you have high levels, then you're unlikely to succumb to severe disease or to die. Okay. So, this is definitely something that the doctors should consider. Okay, let's move on. What other potential uses? Let's look at the gastrointestinal tract. So glutathione can help in these ways. It can help promote periodontal health. That's not part of GIT, but it's the oral, but still part of the digestive tract, right? It can treat GERD, right? Esophageal reflux disease or disorder, and Barrett's esophagus. That's where the damage is sufficient enough to cause obvious pathology. Of course, it promotes general GIT health. It can help manage gastritis, ulcers, and H. pylori infection. It can help prevent leaky gut syndrome, and it supports healthy gut microbiome. Okay, so in the mouth, glutathione may help improve your periodontal health and may help protect against oral cancer. Okay, so something to consider. And then in GERD, glutathione is found to be depleted in the esophagus of GERD sufferers, and boosting glutathione may expedite healing. All right, this is found in studies. In the GIT, gastrointestinal tract in general as a whole, the primary role of glutathione is to protect cells from oxidative stress. It is also anti-inflammatory. It's also crucial for the detoxification and immune functions of the GIT. Right, so glutathione is abundantly distributed in the mucosal cells of the GIT, provided you have enough glutathione, of course. Okay. And there is a direct relation between glutathione concentration and GIT mucosal health, right? Just like in the chronic diseases reviewed, but if for general health also, the more glutathione you have, the more healthy is the GIT mucosa. And there is a direct relation between glutathione-related enzymes and the various pathological conditions, including cancers of the GIT, right from esophagus to rectum. By the way, these enzymes are stimulated by high intake of fruits and veggies. Okay, so healthy levels of glutathione is needed to maintain a normal antioxidant potential in the mucosal cells of the GIT to maintain health and avoid diseases associated with low glutathione. Okay, and age, gender, drugs, and alcohol consumption affect glutathione concentration. Right, so for healthy GIT tract, healthy oral cavity, you need high levels of glutathione. What about gut and immunity? It is estimated that 60 to 90% of our defense against infections and toxins occurs in the intestines, right? Before this gain access into the body tissues and organs. It is glutathione that empowers our immune cells lining the gut and detoxifies many types of toxins. Okay, in the evolution of gastric cancer, you start with healthy stomach, then you have H. pylori infection, then you develop gastritis, it becomes erosion, become ulcer, and cancer. And glutathione has a very big role in this story because it has been found that again oxidative damage is a big factor in this progression. And glutathione, being a very powerful antioxidant, can play a big role. But what more, they found that H. pylori infection causes depletion of gastric mucosal glutathione, also causes inflammation and hyperproliferation of the gastric mucosa. Boosting glutathione resulted in inflammation and epithelial proliferation levels returning to baseline levels. This indicates that glutathione supplementation may help in reducing tissue damage caused by H. pylori infection. Okay, so boosting glutathione should be considered as a supportive therapy during H. pylori eradication therapy. But I'm not aware of any doctors doing this. H. pylori infection is quite common, right? Just do once in a while check for your H. pylori infection at the clinic. But in the treatment, yeah, there's a standard treatment, triple therapy treatment, but glutathione is not in there. But for those of us who have knowledge of this, should add glutathione as part of the therapy. Okay, and why is it important to eradicate H. pylori? Because H. pylori infection is precancerous, is considered precancerous, because especially if it's already progressed. If it's the esophagus, if it progress to Barrett's esophagus, then there's likelihood of progressing to cancer is high. And for H. pylori in the stomach, there's likelihood of progressing to stomach cancer. Okay, so the gut is precancerous. H. pylori in the stomach is precancerous. It may be surprising to some of us because we've been told all this while that the highest concentration of glutathione is found in the human liver. But I discovered in this paper that the normal gastric mucosa has higher level of glutathione than human liver. All right, so that's where it's highest. Not surprising because it has to protect the stomach lining from the very corrosive stomach acid. The stomach acid is very strong. Those who have gut, who have had the acid go up to the mouth, they will testify. They're really painful. What about protecting from leaky gut syndrome? Glutathione in the cells lining the intestines helps to heal and regenerate these cells and restore the intact barrier and prevent leaky gut syndrome. In fact, severe cases can be helped with IV glutathione for faster repair. What about maintaining healthy gut microbiome? Glutathione is in the intestinal lining, maintains healthy cells, which in turn help maintain healthy microbiome. And there are some types of bacteria, probiotic bacteria, that actually also synthesizes glutathione and helps increase the glutathione levels in the gut. Okay, earlier on we mentioned liver damage due to paracetamol poisoning, and that some doctors and other practitioners also boost glutathione to help alcohol damage liver and other instances of liver disease. But in NAFLD, or non-alcoholic fatty liver disease, it is research has been done, and the role of oxidative stress in this condition is well known and would explain the rationale for the use of glutathione as potential therapy. Right? It's not a standard therapy. We're saying that it should be considered because the studies currently available on the use of both oral and parenteral glutathione or its boosters are promising, and especially in the situation where, although several drugs are under investigation, there are currently no approved drugs for this condition. So you have a safe, versatile alternative by boosting glutathione, and you get all the hundreds of other benefits. You know, I think more than 50% of us adults, if you go for ultrasound of the liver, there will be some degree of fatty liver. What about for insulin resistance and diabetes? Glutathione improves insulin sensitivity, and this can help improve diabetic control and possibly even reverse the disease. All right? And we all know that glutathione protects many organs from organ damage, and diabetes, especially chronic severe diabetes, damages many organs. So glutathione will protect these organs from the harm of diabetes, can slow down, reduce, or possibly even reverse the damage. So high glutathione levels in healthy people may also help prevent or delay the onset of diabetes by keeping the insulin receptors healthy. Okay, so the insulin receptors are damaged by free radical toxins, chemicals, and other factors, many of which can be neutralized by glutathione. So glutathione can help prevent, slow down, or even reverse diabetes and its complication. And we know that the oxidative damage that is behind most of the damage that happens in diabetes, this is happening even before you see any of the complications, because it has happens at the biochemical level first before you see the overt signs and symptoms. And both the micro and macro vascular damage can be traced down to many of these harmful molecules, either reactive oxygen species or reactive nitrogen species. And glutathione is found to be able to protect the cells and the organs from the damage from most of these reactive species or reactive molecules. And not only is glutathione crucial to keep the insulin receptor healthy and therefore improve insulin sensitivity or reverse insulin resistance, many of you may not know that glutathione is involved in the control of insulin secretion by the beta cells in the pancreas. You can see the glutathione right in the center there, right? In how how the regulation of release of insulin happens in the beta cells. So you see how versatile glutathione is. Everywhere you find it is there. These are some references on glutathione and how it improves insulin sensitivity. What about cardio and cerebrovascular diseases? Right, this can be myocardial infarction, stroke, and then even claudication. So glutathione is involved in the health of endothelium and especially in its regulation of nitric oxide activity. Endothelial dysfunction and reduced nitric oxide activity are associated with atherosclerosis and its clinical manifestations such as unstable angina. So in the heart, it's unstable angina. Then in the neck and brain, then you have a stroke or TIAs. Glutathione improves human endothelial dysfunction by enhancing nitric oxide activity. The preservation of endothelial glutathione biosynthesis is not only critical for endothelial function, but also in anti-fibrotic responses, right? In lung and kidney arteries as well. So nitric oxide activity also requires signal from sex hormones, testosterone and estrogen. Just to remind you that while glutathione is important in regulating nitric oxide, but there are other factors, including the sex hormones, that are also important. So why is healthy endothelial function important? It is because its dysfunction is associated with vascular damage present in many major degenerative conditions such as atherosclerosis, hypertension, diabetes, and aging. Oxidative distress is the major cause of the impaired vascular function, and the disturbed redox state of endothelial cells impairs nitric oxide production and therefore the ability to maintain adequate vasodilatation. And glutathione, as we all know, is the most important restorer of redox homeostasis. So you see, this, the basic starting point of the health of the arteries, coronary arteries, and the carotid arteries requires healthy levels of glutathione, but it is not part of medical consideration, right? Thinking of what drugs to give or lowering the cholesterol. But this is the basic science first. What about the clotting? Thrombosis is associated with oxidative stress, increased glutathione peroxidase, indicating increased utilization of glutathione to combat the oxidative stress. And at the same time, glutathione peroxidase deficiency is associated with increased thrombosis risk. Then we also know that glutathione reduces platelet aggregation. And finally, fibrinogen is susceptible to oxidative stress and uric acid, and glutathione are its strongest protectors. So, glutathione being a substrate of glutathione peroxidase is required in the first point there. Second, it is directly also an antiplatelet aggregator. And thirdly, it also involved in the healthy function of fibrinogen. Okay, so at least 3 ways it affects the coagulation. Okay, so I just go down, read at the bottom part there. Inflammation increases pro-coagulation factors and also inhibits natural anticoagulation pathways and fibrinolytic activity, causing a thrombotic tendency, right? And glutathione is a potent anti-inflammatory agent and can prevent this, all right? So once you have oxidative stress, then you also have inflammation. So in both ways, glutathione can help. So a combination of oxidative stress and inflammation increases thrombotic risk significantly. Glutathione is both a powerful antioxidant and anti-inflammatory molecule that helps maintain normal blood clotting and clot-dissolving tendencies working at several mechanisms in the coagulation and anticoagulation processes. Glutathione helps maintain healthy clotting control. But no, the doctors give aspirin, they give all sorts of drugs, and then have to contend with all sorts of side effects. Whereas boosting glutathione should be the first line in helping maintain healthy clotting. And especially in diabetics. Now, diabetics has increased clotting tendency. So studies have shown glutathione reverses the clotting tendency in diabetes. It reverses the platelet activation, protein glycation, and pro-coagulation responses, and protects against thrombosis in the diabetic brain and possibly other organs too, right? The study showed. What about neurodegenerative diseases and aging? Again, oxidative stress, disrupted mitochondrial respiration, and mitochondrial damage are involved in various neurodegenerative disorders, including Alzheimer's disease, DLB, Parkinson's, and even schizophrenia. Okay, and these changes to a lesser degree could also be responsible for the decline in cognitive functions in what we call normal aging, because we all also know our memory is affected, our eyesight affected, our hearing affected, many functions are affected. Okay, so there are studies showing that glutathione can help protect the brain, but again, because it is not a drug and no drug company can make money, while the earlier small studies are very positive, no follow-up big studies, right? Because there's no money to be made. Again, for Alzheimer's, from what we know from the science and from the smaller studies already done, right? Glutathione has a big potential in preventing and slowing down and even reversing Alzheimer's disease. Likewise, for schizophrenia, studies show a direct correlation with schizophrenia and decreased glutathione levels, and glutathione may slow down the progression and even lessen the side effects of the drugs given to treat this disease. In autism, it was found that levels of glutathione are significantly lower in autistic children than in children without autism, and glutathione deficiency could be the cause or contributing factor for autism. Right, and in some autistic children, it was found that one of the genes related to glutathione synthesis is implicated. So they have low levels because the production is defective because this gene is defective. And boosting glutathione have been shown to help autistic children and adults. But it is not standard therapy yet. There are some, I'm aware, in fact, many doctors throughout the world treating autism or autistic children and adults do use glutathione boosters. These are some references. Finally, we come to autoimmune diseases, in particular rheumatoid arthritis, SLE, and psoriasis, because we have excellent testimonies of improvements and reversals of these diseases after boosting glutathione with the precursor that we have. Right, and this was what actually introduced me to the powerful role of glutathione in reversing autoimmune diseases. Prior to being introduced to this the precursor that we have, I was already using glutathione precursors as part of my anti-aging practice. But this really amazed me, and I was privileged to be with this lady from the beginning, and was able to observe all this as it was happening. That boosting glutathione with the precursor was able to do what even the drugs could not do, right? You can see the improvement from having a distorted, typical distorted rheumatoid arthritis fingers um, to healthy, normal, straightened uh, fingers, right? And the drugs will give so much of side effects, whereas using glutathione precursors will give many other positive effects. This is rheumatoid arthritis. Of course, this is not the only case, but this is the most classic case that we have seen among the users. And then with SLE, we also have excellent testimonies of those who were on drugs but couldn't withstand the drugs, and then on high doses of precursors was able to reverse the disease without side effect, but with many other positive effects. So what is the science of glutathione and SLE? SLE or lupus is the most destructive of all autoimmune conditions. Existing data in the literature provide evidence that glutathione is depleted in T cells of patients with SLE. This may be a key factor underlying abnormal activation and predisposition of T lymphocytes to pro-inflammatory cell death by necrosis. And research shows that glutathione plays a critical role in upregulating T regulatory cells, bringing Th1 and Th2 back to balance, and calming autoimmunity. There is a significant correlation between plasma glutathione and SLE severity. This may aid evaluation of the disease severity and usefulness of the management of SLE. Those with the most severe symptoms had the lowest glutathione levels. Right? So the science has been there all the while, but drugs have been the standard treatment. So after being exposed to these cases, now in my own practice, boosting glutathione is my first line treatment. In fact, I have helped at least 2 medical doctors, who couldn't stand the drug therapies. I've helped them reverse their rheumatoid arthritis with high doses of precursors. Okay. And then is an example of psoriasis just after 1 month of treatment with precursors. You can see improvement. I mean, if you have a person like this, they must have been on treatment for many years. Okay. So now we come to the end. So we know that how important glutathione is with so many functions. Very underused by the doctors with only a few established indications, but there's so many potentials, but remain as potential use because of lack of large studies to make actual therapeutic claims. But those of us who know about the science, about the positive results of whatever studies that have been done, and from our own experience, and knowing that glutathione or boosting glutathione is safe, plus also you have a whole list of benefits that come together, whatever is the reason you want to boost the glutathione, then there's no reason why we should not consider. But even in the healthy person, we should know that as we age, as part of our aging, the glutathione levels go down at a rate of 10 to 15% every decade, such that when you're 40 years old, you are 20 to 30% down. When you're 60 years old, you are 40 to 60% down. So knowing the signs, then you are predisposed to a lot of diseases. So we should aim to keep our glutathione levels high. So how do we boost up our glutathione levels? First, we have to try to avoid or overcome all those causes of glutathione depletion. And if this is your lifestyle, you can expect your glutathione to be much lower than average. So if you can avoid this, then it's good. But if you can't, then you know that you will need to desperately need to boost your glutathione because you're expected to have much lower glutathione than average. Okay, so the first take-home message is glutathione taken orally is not well absorbed. Most studies show that it's not well absorbed. One or two studies show that some forms of glutathione, oral glutathione, may be absorbed, but in general, this is a correct statement. So since orally, it is not possible to increase glutathione, so what do? We help the cells manufacture by providing the raw materials or the precursors. Okay. So the best way is to boost your glutathione, to supplement with glutathione precursors and boosters, and to enable our cells to manufacture glutathione. And glutathione, if you remember, is made of 3 amino acids. The studies have shown that cysteine is the rate-limiting precursor. So you need only to provide a stable form of cysteine. And currently, the best source is a molecule called ribocysteine, trademarked as ribosine. Okay. And how efficient is it in boosting glutathione? Right. Whey protein is a source of cysteine and also methionine. And if whey protein boosts glutathione by a factor of 1, then studies have shown that NAC is 8 times more efficient than whey protein. And studies have also shown that ribosine or ribocysteine is 3 times more efficient than NAC, which means it is 24 times more efficient than whey protein. So that is how efficient ribosine is in boosting glutathione. Okay, what is ribosine? It is D-ribose and L-cysteine. So this provides a stable form of cysteine, which will then be absorbed and be made available to the cells to make glutathione. And it is stabilized by a simple sugar called ribose, which is not utilized to make energy, which is not burned to make energy, but instead is used to make ATP and other molecules in the body. And ATP is required in the synthesis of glutathione. So ribosine is a unique precursor because it also provides the battery power to manufacture glutathione, which is why ribosine is 300% more efficient than NAC. NAC is the most studied precursor, right, in boosting glutathione. So conclusions, glutathione is the body's most important intracellular antioxidant and is the most abundant antioxidant in the important organs, including the brain. Glutathione is the master antioxidant that is not only very powerful, but can also rescue other antioxidants. Glutathione protects the body through its antioxidant, anti-inflammatory, immune-boosting, detoxifying, and many other actions. Low glutathione has been associated with many diseases. Supplementation or treatment with glutathione or its precursors has improved or reversed some of these diseases. Example, autism, dementia, Parkinson's, schizophrenia, SLE, rheumatoid arthritis, psoriasis. And local experience, we have remarkable improvements in some diabetics, rheumatoid arthritis, SLE sufferers. Okay. It is difficult to overstate the importance of glutathione because it performs many critical biological functions. Glutathione is a major factor in the regulation of cell life, vitality, proliferation, and death. One of the most important proactive steps people can take to improve their health and slow down the onset of age-related diseases is to boost their glutathione level. And more clinical studies should be done to validate the positive results seen in clinical practice and testimonies. And in the meantime, health practitioners should explore the use of glutathione precursors in those conditions where current therapies are unsatisfactory or come with adverse effects. Okay, so I would really like to suggest to doctors and health professionals, especially those who prefer natural therapies over drugs, to try glutathione precursors and in particular ribosine or ribocysteine as first-line therapy. Especially if you have patients coming in with rheumatoid arthritis, SLE, and you can try, and should also consider giving to those with all those gastric problems, GERD, right? And for healthy GIT tract. Okay, we have two products that are based on ribosine. This is Max 100% ribosine. And this is Celgevity, which is ribosine plus 12 other ingredients that not only help in the function of glutathione, but also have their own health and anti-aging benefits. And Celgevity is therefore an anti-aging powerhouse. Thank you very much.